Hi everyone, so good afternoon. Welcome to Friday Reading Live. My name is Vandana PS, one of the reading trainers from Needus Academy. Yes, so have you all joined this live segment? Let me please check. Good afternoon, yes, once again. Okay, so shall we do a sample question from part B? Ready? Yes. I'll give you a sample question from part B, then we will discuss part A in detail today. So we have a new material here. So I'll give you, as usual, 2 minutes for the completion of this question. So here comes the question. Yes. So how was this question? എങ്ങനെ ഉണ്ടായിരുന്നു? Hi Riba, Pinky, Najma, Papati, Jissa, Vaishnavi, Roshna, Neetu, Maria, Divi. Good afternoon, everyone. All right. So have you all done this question? Okay, I'll read the question, then we will move on to the answer. Okay. The main point of the notice is that hospital staff dash. So this is an incomplete question. So we need to complete it. All right. So when you all read the question, you can connect with your options here. So the main point of the notice is that, so my keywords from this question, it is a notice. I understood that this is from this third category. Notice. Hi Clarina, good afternoon dear. Then hospital staff. Okay, so when you underline keywords, it shouldn't be more than 3 individual words. It should be 3 individual words. Okay. So notice is that hospital staff need to be aware of the relative risk of various bodily fluids. So my keywords need to be, okay, aware, then risk. So these are my keywords from option A. And hospital staff should regard, which means should consider, all bodily fluids as potentially infectious. So my keywords should regard infectious. And option C, the main point of the notice is that hospital staff must review procedures for handling bodily fluids. And my keywords must review procedures. So these are my keywords from these 3 options. Okay, so let me know your answer please. What is your answer? Okay, whether it is option A, B or C, and you guys already know the rules and regulations which we are following here when you do part B. Okay, it's all about 3 categories, and this is from the third category, either a notice, email, memo, and this is very clearly mentioned, this is a notice. And what are you reading for in the third category? എന്തിനു വേണ്ടിയാണ് third category വായിക്കുന്നത്? Yes, hi Delighta, good afternoon dear. So why we are reading the third category? We are reading for the purpose. Okay, so purpose, which means the overall idea. So what is the overall idea of the notice? And it is in the heading itself, infection prevention. Okay, infection prevention. And what is mentioned in the notice? So I'm reading the notice. Infection control measures are intended to protect patients, hospital workers and others in the healthcare setting. While infection prevention is most commonly associated with preventing HIV transmission, these procedures also guard against other bloodborne pathogens such as hepatitis B and hepatitis C, syphilis and Chagas disease. They should be considered standard practice since an outbreak of endemic illness can easily occur in a crowded hospital. Okay, so any of the options can be eliminated from the first para. So actually in part B, I would suggest you to do this method. What method? Which means read the question, read the options, underline the keywords. Then when you read the paragraph itself, along with that you can eliminate options. അതായത് പാരഗ്രാഫ് വായിച്ചുകൊണ്ടിരിക്കുമ്പോൾ തന്നെ എലിമിനേറ്റ് ചെയ്യുക, that would be better. Okay? Yes. So any options can be eliminated from the first paragraph. Hi Neetu Reni, good afternoon dear. Yes, Najma. Okay. Okay, start Delighta, it is purpose. Yes, Jissa, purpose. Okay, Najma, we are reading for the purpose. Okay, Papati, yes, we are reading for the purpose. Okay. And what about the first para? Can we eliminate any of the options from the first para? First para വായിച്ചു കഴിയുമ്പം ഏതെങ്കിലും ഒരു ഓപ്ഷൻ എലിമിനേറ്റ് ചെയ്യാൻ പറ്റുമോ? Can we eliminate any of the options after reading the first paragraph? Okay, option C can be eliminated. How? Must review procedures for handling bodily fluids. Okay, so in the first paragraph very clearly mentioned what are the preventive measures, right? So what are they? Once again I'll read the first para. Infection control measures are intended to protect patients, hospital workers, others in the healthcare setting. While infection prevention is most commonly associated with preventing HIV transmission, these procedures also guard against other bloodborne pathogens such as hepatitis B and C, syphilis and Chagas disease. They should be considered standard practice since an outbreak of endemic illness can easily occur in crowded hospitals. So these are the conditions that may occur. Okay, so it should be very careful. And what about the second para? Infection prevention depends upon a system of practices in which all blood and bodily fluids, including cerebrospinal fluid, sputum and semen, are considered to be infectious. That means each and every fluids are considered to be infectious. Infectious. So that from that line we can connect or we can trace to which option? The option like trace here. We can trace towards option B. Should regard all bodily fluids as potentially infectious. Okay, so that is from this particular line. Then all such fluids from all people are treated with the same degree of caution. From the same line, again I am tracing to the same option, okay, from the next line. All such fluids from all people are treated with the same degree of caution, so no judgment is required about the potential infectivity of a particular specimen. Then hand washing, the use of barrier protection such as gloves and aprons, and the safe handling and disposal of sharps and medical waste, and proper disinfection, cleaning and sterilization are the all part of creating a safe hospital. So the rest of the line, it's all about how to be safe. Okay, so what about option A and C? Any idea? How can we eliminate option A as well as option C? Engane eliminate TM? Okay, Ginny. Hi, Mithun. Good afternoon. Yes, Roshna, Jissa, Sobi. Hi, Sobi. Okay. Oh, very good. Good enough? Okay. Okay, so not majority, all of you got the correct answer, which is option B, and I'm so happy. Okay, for the first time, yes, you got option B, the correct answer. So what about option A and option C? So my next question is, how can we eliminate option A as well as option C? Option A and C, you can eliminate. Yes, okay, Jissa, option C is contradictory sentence, must review procedures. So we can't review it because they are considering each and every fluids as potentially infectious. Okay, so that means contradictory option or opposite option. And what about option A? Need to be aware of the relative risk of various bodily fluids. Where is it mentioned? Need to be aware of the relative risk of various bodily fluids. I will say not mentioned. Yes, aware of it. Okay, so we can say not mentioned. Answer is option B. Should regard all bodily fluids as potentially infectious. Okay, so option A, not mentioned. Very good, yes. Okay, Vaishnavi. Yes, Najma, it is not mentioned. Okay, Jissa, it is not mentioned. Option A is not mentioned. Very good. Okay. Then, so please tell me. Okay, so what do you know about part B? Ninka part B le endha karayam? Onnu parayamo? What do you know about part B? Okay, about the number of questions that you know, what method that you will use, okay, or what strategy that you will use. Then what else? What type of questions will be there? What category of questions will be there? Let me know in the comment box. Yes. So what do you know about part A? Sorry, part B? How many questions? Very good. Yes, Reba, 6 questions. Okay. Second one. What about the time? 6 questions will be there, okay? Then what about the time? What about the time? Is it half an hour or 15 minutes or 12 minutes or 10 minutes? Okay. Yes, so what about the time? You guys are commenting about the questions and the method. Yes, what about the time? Okay, Riba, it's 10 to 12 minutes. Okay, then there is no separate time for part B and C. Yeah, it's almost 45 minutes for part B and C. And you can take maximum 10 to 12 minutes for the completion of part B. Yes. Very good, Vaishnavi. Yes, that means there are total 6 questions will be there. So for the completion of 6 questions, for one question, you will get almost roughly I can say 2 minutes. Okay, 2 minutes for one question. Then, so what about the strategy? In the strategy, you use here. In the method, you use here. What about the method or what about the strategy? What about the strategy? Very good, yes. Elimination method or elimination strategy. And here also in part B, you can use skimming and scanning method, but the appropriate method to find out the answer, which is elimination method. The skimming and scanning, use that means speed reading and underlining the important words. That's fine, that's okay, it's better. But I know that along with that, you can apply elimination method to find out the answers. Okay, so that's all about this strategy. Elimination, what is elimination? Okay. Yes, Najma, Divi, Delighta, Vaishnavi, Jisa, it is elimination method. Very good. So the next question, what type of questions? In the type of question, Anam. What type of questions will be there in part B? What type of questions? What type of questions will be there? As well as in part B and part C, yeah, the same type of questions will be there. So what is it? In the type of question, Anna? Yes, multiple choice questions with 3 answer options in part B, and in part C, multiple choice questions with 4 answer options. Okay, that is the only difference. Very good. And what about the category? How much or how many categories are there in part B? If the categories of questions are down. Okay, Najma, multiple choice questions. Well, okay, so what about the category? How many categories will be there? 3 categories. Okay, 3 categories of questions will be there. Only 3 categories. Okay, I repeat, only 3 categories of questions will be there. Okay, so now we are moving to the new topic here, which is PKD. Okay, or polycystic kidney disease. Okay. So today I am just moving to the questions. Okay, let me know about your questions, because when I read the paragraph and the keywords, it's very easy for you to answer the questions. So today I think I'll jump to the questions first. So please let me know what are your answers. Then let's discuss about the keywords and the important things in part A. Okay. Yes, Jissa. Okay. So what about the first question? Let me know in the comment box what is your answer for the first question. Today, as I already informed, this is the last material, which means in this week's last material. It will be, and it is a tough material. Okay, this is a tough material when you compare with the previous one. Innala nammal cheyidapam 1 to 14, it was tough, but 15 to 20, it was very easy. All direct questions are, no, but this is not like that. It is not. Okay, 1 to 20, yeah, some random questions are like, easy, very easy questions, but otherwise it will be difficult. I know. Okay, what about the first one? So let me know about your keywords and your answer. എന്താണ് നിങ്ങളുടെ keyword plus എന്താണ് answer എന്നുള്ളത് ഒന്ന് mention ചെയ്യുക. First one, aggregate numeral of individuals in the analysis of congregation. What are the keywords from the first question and what is your answer? No answers? First question and keywords and your answer, or else you can just type your answer, that's fine. Was it difficult? Difficult ayirno? First one, I don't think so, because we have certain keywords here, so it is very easy for you to understand the correct answer. Okay, aggregate is my first keyword. Numeral congregation. Okay, aggregate, which means, what is the meaning of aggregation? Aggregate, which means total. Okay, numeral, which means the number. Analysis, which means, and you know what is analysis? Congregation, which means the group. So read it. Total number of individuals in the study group. Now tell me what is the correct answer. Okay, I made it very simpler. So total number of individuals in the study group, that is the question. Aggregate numeral of individuals in the analysis of congregation. Okay, Jissa, very good dear. Your answer is absolutely correct, which is C. Okay, Najma, your keywords are aggregate, analysis, congregate. Okay, congregation, which means the group. Okay, a contingent എന്ന് പറഞ്ഞാലും group ആണ്. So analysis, congregation, which means study group ആണ്. Okay, see, synonym ആണ് യൂസ് ചെയ്തേക്കുന്നത്. Okay, yes, very good Manju, answer is correct, which is C. Okay, Najma, I hope you got the correct answer, right? Okay, second one, which are the two classifications of PKD? This is a very direct answer, not that much tough. Two classifications PKD. Okay, Reba and Pony, which is text C. Okay guys, what about second question? Which are the two types of classifications of PKD? Two classification പകരം എന്ത് പറയാം? I can say types. Okay, so which are the two types of PKD? Yes, answer is from text A. Okay, so first question, text C, study population, see number of people. And second question, which is from text A, two types of PKD. Okay, so answer is A. And what about third one? Third question. So here, some unfamiliar words are here. Requisite to have the compliance from the healthcare regarding the intake of pain medication. So my keywords, requisite, compliance, and intake. Yeah, so these are my keywords from the question. Answer in the parayamo. Third one. Okay, Riba and Jissa, second one, classification, which means the types. Very good. Okay, Delighta, keywords to classification PKD. Okay dear, answer is text A. Excellent, very good effort. Okay, Puni, third one is text D, right? Answer is correct, very good. So requisite, which means necessary, important. Compliance, which means what I can say. What is the meaning of the word compliance or compliance? Okay, compliance, which means approval. Okay, I can say, yeah, approval. So requisite, which means which is important or necessary. Compliance, which means approval. And any other words? Yeah, rest of it was easy. Yes, answer is from text D, intake of pain medication. See, from this particular sentence you will get the answer. Like pain medication the karyam parayunnathu, that's only in text D. The last one, pain management. Okay, so that means answer is from text D. Fourth one, the chance of instance of conditions can be condensed through the conserving of ideal pressure. So my keywords, conditions, then conserving, pressure. What about fourth one? Conditions, you know, instance, which means what? Occurrence, the presence. Okay, instance, the meaning is occurrence. Yes, conserving, which means what? Condensed എന്ന് പറഞ്ഞാൽ അറിയാലോ, reduce ചെയ്യുക, decrease ചെയ്യുക എന്നുള്ള മീനിങ് ആണ്. So reduced or decreased. And conserving, which means maintain ചെയ്യുക. Okay, maintenance or conserving എന്ന് പറയുമ്പോൾ maintaining ആണ്. Okay, maintaining. Yeah, ideal pressure. Okay, any idea? Fourth one. Okay, Jissa, last point is there. Adana, that is third question. Okay, what about fourth one, dear? Fourth one. Okay, Riba, again, fourth one, it is text D. Very good, yes. Yes, correct answer. Excellent. Okay. So, where is it mentioned, fourth one? Chance of occurrence of conditions can be reduced through maintaining ideal pressure. What about the pressure mentioned there? Blood pressure. Okay, so that's mentioned in text D. Yeah, the first sentence itself. Blood pressure management. Yeah. Okay, so that's from text D. And fifth one. Hi Nazia, good afternoon dear. Okay. Yes, Jisa, in blood pressure, yes, correct answer. What about fifth one? Ideal age to confirm ADPKD in childhood. Okay, actually this is an abbreviation, you know that. Ideal age, confirm condition, yeah. Fifth one. Okay, Reba, fifth one, it is text A. Okay, and where is it mentioned in text A? The ages. Any ages mentioned here? Yeah. Between the ages of 30 and 50. So, answer is from text A. Okay. Yes, Ponni, Reba, Manju and Nazia. Text A. Excellent. Sixth one. What specification got considered in the evaluation to GOG? The perseverance, pervasiveness of ADPKD. Not perseverance. Yeah, pervasiveness. Okay. Specification, evaluation, pervasiveness. So what is pervasiveness? That means commonness or exact meaning, I can say prevalence. Okay, prevalence. Then evaluation, you know, GOG and the what is GOGing? Okay, Jisa, it is 30 to 50. Yeah, that is fifth one. Age, it is 30 to 50 from text A. Sixth one, what is the sixth one? Yes, Najma, it is from text A. What about sixth one, dear? Okay, specification, you guys can take it as a criteria. The criteria mentioned there got considered in the evaluation to GOG. Evaluation analysis or the study. Okay, GOG is calculate or assess. Here calculation meaning that's assessment. Okay, assess. Prevalence of ADPKD. So answer is mentioned here. Very good. It's in text C. Very good, Nasia. Yes, good effort. Yes. It's from here. ADPKD prevalence. See? Kanda. That means what? Pervasiveness. Right? Yeah. And study, it's all about the evaluation. Yeah, study population evaluation. So answer is from text C. Okay, so my answer is C. Seventh one, factors accountable for. Accountable responsible. Factors responsible for the instigation of. Okay, instigation. What is instigating? Instigation, which means development. Okay, I hope it is clear. I think that you guys can read it very clearly. Yeah. So, factors responsible for the development of liver cyst in women. Direct answer. So, where is this liver cyst mentioned? Okay, Liji and Pony, yes, it's from text C. Sixth one. What about the last one, seventh one? Seventh one, Avdaya. Factors accountable, responsible for the development of liver cyst in women. Yeah. Okay. Okay, Nasia. Very good, dear. Yes. It's B. Text B. Yes, Najma, it is text B. And where is it mentioned in text B? Okay, I think it's here. Yeah. Growth of cyst in the liver. See? Okay, so case is mentioned here. And women is here. So, yeah, all the keywords are here. So, answer is from text B. Well, so anyone with 7 out of 7? No. 7 out of 7. Yes, Nasia, it is in the first line here. Yes, very good, yes. Ade. Okay, so second category, not second category, yeah, second session. 1 to 7, it is match the following, then short answers. Okay, first one. Manju, Najma, Jissa. Excellent, okay, very good. Okay, Delighta, Jissa. Very good, very good. I'm so happy. Okay, so what about 8th one? The two particulars employed to appraise the risk curve of ADPKD. So here, there is no change in risk curve. It is directly mentioned there. ADPKD, it is there. There is no change in that. But the change vannekkunnathu endinokkeയാണ്? 2, it is the same. Particulars, employed, appraise. Okay, so particulars, which means what? Levels, I can say what? Aspects. Okay, that is the best word. Aspects. Employed and the used. Appraise and the, what do you mean by appraise here? Can you connect? The two aspects used to appraise the risk curve of ADPKD. Yes. Okay, Nazia, 6. Okay, okay, dear, it's okay. Okay, Papati, yes. What about 8th question, dear? Two particulars, two aspects. What are the two aspects mentioned? And answer is, I think it is from text C. Yeah, aspects mentioned in text C used to appraise, which means I can say evaluate. Okay, evaluate the risk curve of ADPKD. So here in text C, what are the keywords? Risk curve is here, and ADPKD is mentioned. Estimation of ADPKD using logistic regression, predicted affected, estimated prevalence by gender and age. Okay, so answer is yes. Yes, very good, Jissa. Answer is age and gender. Don't write by age and gender. Answer is age and gender. Because രണ്ട് factors ആണ് ചോദിച്ചിരിക്കുന്നത്. That is age and gender. Okay, so answer is age and gender from text C. 9th one. The conclusive strategy carried out if ADPKD advances to end stage renal failure. So my keywords: end stage, ADPKD, as well as conclusive strategy. Okay, so conclusive strategy, conclusive, which means that ultimate. Okay, and strategy, here strategy, what is strategy? Procedure, alle? Yeah, procedure. So the ultimate procedure carried out if ADPKD advances, advances, which means what? Advance here, but advance actually progress on, so progresses. Okay, to end stage renal failure. Yeah, the final stage. Okay, Rose, yes, it is age and gender, dear. Very good. What about 9th one? Get your answer, get your 9th one. The ultimate procedure carried out if ADPKD progresses to end stage renal failure. What is the procedure? Procedures mentioned, of course, in text D. Management il edo arno aanennu ariyam alle. So what is the procedure? Progress cheya, advance cheya, adokka avada mention cheyidekkunne. That's here. Kidney transplant. Okay, you may need a kidney transplant if ADPKD progresses to end stage renal failure. See, answer is kidney transplant. That is the correct answer. Adana procedure, alle. Okay, so that is kidney transplant. Okay. Okay, Jessa. Okay. Then 10th one. What condition would be burgeoned? Burgeoned എന്ന് പറഞ്ഞാൽ എന്താ? ഫ്ലറിഷ് ചെയ്യുക, അല്ലെങ്കിൽ ഇൻക്രീസ് ചെയ്യുക, ഡെവലപ്പ് ചെയ്യുക, പിന്നെന്താ ഇംപ്രൂവ് ചെയ്യുക, പ്രോഗ്രസ് ചെയ്യുക, ഇതൊക്കെ ബർജിയൻ ആണ്. യാ, സോ ഇവിടെ ഡെവലപ്ഡ് ആണ്. ദാറ്റ് ഈസ് ദ ബെസ്റ്റ് alternative word, I guess. Developed. Yeah. Okay. in 1 in 4 proportion. 1 in 4 proportion, I think it is not directly mentioned. Instead of that, they have mentioned 25%. Alle? 25% ആണ് മെൻഷൻ ചെയ്തേക്കുന്നത്. ദാറ്റ് ഇസ് ദ പ്രൊപ്പോർഷൻ ഓഫ് മെച്ചുവർഡ് പീപ്പിൾ എന്ന് പറയുമ്പോൾ അഡൾട്ട്സ് ആയിരിക്കും. അഡൾട്ട്സ് വിത്ത് പോളിസിസ്റ്റിക് കിഡ്നി ഡിസീസ്, അതായത് PKD. യെസ്, അഗൈൻ ഞാൻ ക്വസ്റ്റ്യൻ സിമ്പിൾ ആക്കിയിട്ടുണ്ട്. വാട്ട് ഇസ് ദ കറക്റ്റ് ആൻസർ? വാട്ട് കണ്ടീഷൻ വുഡ് ബി ഡെവലപ്ഡ് ഇൻ 25% ഓഫ് adults with PKD? Very simple question. ഇങ്ങനെ നോക്കുമ്പോൾ very simple. So what is the condition? Okay, അത് ഡിഫിക്കൽട്ട് ആയിരുന്നോ? Okay, so answer is from here in text B. What is mentioned here? Heart valve abnormalities as many as in 1 in 4 adults. Yes, exactly അതെന്നെ കൊടുത്തിരിക്കുന്നത്. Or 25% of adults with polycystic kidney disease, അതായത് PKD ഡെവലപ്പ് ചെയ്യുന്ന പകരം എന്താ കൊടുത്തിച്ച്? അതായത് ബർജിയൻ അല്ലേ? ബർജിയൻ ആൻസർ എന്താ? മിട്രൽ വാൽവ് പ്രൊലാപ്സ്. ഓക്കെ, ഐ ഹോപ്പ് ഇറ്റ് ഇസ് മിട്രൽ ഓർ മൈട്രൽ. യാ, മിട്രൽ വാൽവ് പ്രൊലാപ്സ് ഇസ് ദി കറക്റ്റ് ആൻസർ. അതാണ് ആൻസർ വരെ. ഓക്കെ, that is the answer. And 11th one, what factors other than medicine should be considered to reduce blood pressure? Okay, ഒരു ഫാക്ടർ കൊടുത്തിട്ടുണ്ട്, എന്താ? മെഡിസിൻ. So what factors other than medicine should be considered to reduce blood pressure? ഇതല്ലാതെ പിന്നെന്താണ്? other than medicine പിന്നെന്താ ചെയ്യാൻ പറ്റുക? what can be done? Very good, Reba. It is diet and exercise അല്ലേ? So where is it mentioned? Diet and exercise management ആണ്. So that means from text D. Okay. Yes. എന്താ പറയുന്നവർ? Yeah. Your provider helps you manage your blood pressure with medicine. Other than medicine, what is there? Diet and exercise. So answer is diet and exercise. Yes, Nazia, Manju, Divi, Delaita, Vaishnavi. Yes, Najma. That's correct. Very good. Okay, I know that it was a very direct answer. Yeah. Then 12th one, which is the atypical form of PKD? ഇതും കുറച്ചും കൂടെ സിമ്പിൾ ക്വസ്റ്റ്യൻ ആണ്. Atypical, which means very rare, not common, uncommon. PKD. So ഏതാണ്? rare form ഏതാ? not common. Okay, don't get confused. common അല്ല, atypical ആണ് ചോദിക്കുന്നത്, which is uncommon or rare. ഏതാണ്? uncommon or rare form of? Yes, Roshna, it is diet and exercise. Very good, dear. Okay, Papadi, yes, it is diet and exercise. What about next one? Yes, Najma, that is AD. Okay, so rare form of it is ARPKD. Kanda? Okay, it is ARPKD. So ഇവിടെ ADPKD is there plus that is autosomal dominant polycystic kidney disease and autosomal recessive ആണ്, that is called ARPKD. is a rare form of PKD. So ARPKD is the answer. Okay. And 13th one. Okay, Manju, yes, Nazia, Jissa, Vaishnavi, Rose. Yes, very good, excellent, yes. Okay, Reba, Najma, Roshna, yes, it is RPKD. Sorry, ARPKD. Okay. 13th one, a fatal condition that may develop in pregnant ladies with PKD. A fatal, severe, develop, pregnant. Yeah. So what about this one? 13th one and answer എന്താ? pregnancy related, pregnancy complications എന്നൊക്കെ പറയുമ്പം I hope it's complication, it's mentioned in text B. So okay, Roshna, it is ARPKD. Okay. Yes, Papadi, it is ARPKD, dear. What about the next one? Please tell me. 13th one. Pregnancy complication is here. So answer എന്താ ആയിരിക്കും? Pregnancy is successful for most women with polycystic kidney disease. In some cases, however, women may develop a life-threatening disorder called preeclampsia. Okay, so what is the disorder? Preeclampsia. Answer is preeclampsia. Yeah, so that is preeclampsia from text B. 14th one, alternate designation for ARPKD. Yes. What is the alternate designation? Any other names mentioned? Any other names for ARPKD? And it's from here, already namal kandadarnu. So, yeah, it's also called infantile PKD. So, answer is infantile PKD. Okay. Answer is infantile. So, question already, I think PKD is there, alle? No, sorry. ARPKD aanu. So, answer should be infantile PKD. Yes. Infantile PKD. Yes, Reba. Delighta. Okay, Devi, why it is high BP, dear? It is preeclampsia. Preeclampsia is the correct answer. Yeah. So, answer is infantile PKD. Okay, Jissa. Nazia, Divi, Najma, Reba, Delighta. It's infantile PKD. Now, it's time to do 15 to 20 set of questions, which is fill in the blanks. Yes, so fill in the blanks. 15th one. What is the missing word here? A medical assistant may advocate dash or human growth hormone for the underweight or underdeveloped infants. Okay, and the answer is yes, Papadi, it is infantile PKD. Okay, dear. Yes, Jissa. What about 15th one? What is the missing word there? Any missing word or missing words? Yeah, tell me. What is the missing word there? Yes, it is not even direct, but still there are some words that can indicate the correct answer. So, answer is nutritional therapy, which is mentioned in medical treatment. That means it is from text D. So, where is this nutritional therapy mentioned? Okay, Nasia, Najma, oh, you guys got the correct answer, okay. Okay, Roshna, yes, Rose. Reba, yes, Papadi. It's not growth therapy, dear, it is nutritional therapy. Growth therapy, nutritional therapy. Okay, see, it comes under growth therapy. Underweight or underdeveloped infants may need help growing. Healthcare provider may recommend nutritional therapy. So, answer is nutritional therapy. Okay. And 16th one, dash or exerted to attribute missing data in the analysis category on the topic of ADPKD. Exerted to attribute. Okay, exerted in the here it is very simple. I can say used. Attribute missing data. Okay. So, what is it? Okay, Papadi, it is nutritional therapy. Very good here. Yes. 16th one, the missing words, it is mentioned used, attribute, missing data. Data, I know that's from C. Analysis category, so it's from C. So, what is it? Yes, see. Impute, that is the keyword from the question. Impute here, see. It is attribute here, that's impute. Okay, so answer is linear mixed models. Linear mixed models is the correct answer. Yeah, a lot of correct answers. Well, okay, Jissa, yes, it's obviously mentioned. Yes, it's clearly mentioned here. Okay, Roshna, yes, Najma, Reba, yes. Very good. And the next one, 17th, the dash can augment. Augment is the increase here. So, the dash can increase. Kidneys augment not increase the kidney. Enlarge. Okay. Enlarge the kidneys and restrain them from filtering waste out of the blood. So, what is it? Yes, Papadi. Yes, Nasia. Linear mixed models. What about 17th one? What about 17th one? 17th one in the dash can enlarge. Yes. Answer is CYSTS. Cistern. Okay. It is plural actually. CYSTS. And where is it mentioned? Text A. It's all about in text A. Yeah. See. The cyst can enlarge the kidneys and prevent them. So, entire, other words are the same here. Answer is cyst. And 18th one. What about 18th? Medicaments, which means medications can be employed, used to regulate pain, to control pain caused by infections dash or burst cysts. Adendana? It's from text D, I guess, because medications are parayunne. Okay, Jissa, it is from text A. Okay, Nasia, Reba, Divi, Najma, Sistana. Okay, so what about 18th one? 18th one and the medication, it's pain management. So pain is one of the keyword there. Provider should approve any pain medicines you take. Some medicines can make kidney damage worse. So, that's the mumbata line. The medicine can manage pain caused by infections, kidney stones or burst. Yeah, answer is kidney stones here. Okay, so that is kidney stones. Yes, Jissa, very good dear. It is kidney stones. 19, second last one. People with polycystic kidney disease may develop a condition called dash, where weakness and pouches or sacs in the wall of the colon can be noticed. What is it? Okay. What is the condition? I think it's one of the complication. Yes. What complication? Colon problem. It's here. Weakness, pouches, sacs in the wall of the colon, that is diverticulosis. Okay. Diverticulosis. Okay, so that's from text B, the last line. And the last question, 20 relatively dash of entire kidney failure cases are the upshot. Upshot and the result on, okay? Result of PKD. So what is it? Dash of nanu parayunne. Appo eniki thonunu relatively, which means approximately. So that means maybe a percentage or a proportion. Okay? And here, see, approximately 2% of all kidney failures. Yeah, answer is 2%. Okay, so that is all about that. So anyone with 20 out of 20? Okay, so please do additional materials every day so that you can improve your marks. Okay, so that's all about today. Take care. Thank you. Happy weekend.